Hello and welcome. It's 11 a.m. here in Seoul. I'm Kim Do-yeon at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the Korean government on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Son Young-rae, Director General of Department of Strategic Planning at Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. Now let's take a listen to what the health authorities have to say.
중앙재난안전대책본부 비대면 정례 브리핑을 시작하겠습니다. 오늘 브리핑은
Today's briefing will be provided by Mr. Son Young-rae, Director General of Strategic Planning. Moreover, we have Ms. Park Kyang present with us today as well, and Cha Sung-kyung as well, who is in charge of the hospital beds for COVID-19 patients. And we have sign language translation available for you today. First of all, here is Mr. Son Young-rae with the explanation on the COVID-19 response here in South Korea.
Let us now begin our regular briefing for August 13th.
Today, the quarantine authorities have discussed measures to secure more hospital beds in the metropolitan area. With the continuing fourth wave, we have seen a large size of COVID-19 patients. Moreover, we are also seeing a rise in the number of critically ill patients as well. Moreover, in the metropolitan area, which account for most of the cases, we are also seeing a decline in the number of available hospital beds. And in the metropolitan area, we have about 300 beds, ICU beds in the metropolitan area that are currently occupied, which is about 70% of the total. And also for the COVID-19 designated hospitals, we have about 80% of the hospital beds which are currently used right now. Moreover, at the live treatment centers, we have a total of 5,000 hospital beds, over 5,000 hospital beds that are available for use for the symptoms, for those with symptoms with light and mild symptoms. And to this end, we believe that we need to also secure more hospital beds in the metropolitan area. And starting from today, the central government has issued the administrative order to also secure more hospital beds. Moreover, we will be securing more 170 more ICU beds in the metropolitan area, and we will be increasing expanding the scope of the ICU units at the general hospitals from 1% to about 5% range. And we will also secure more hospital beds at the large-scale hospital beds, whose hospital beds outnumber about the 700 mark. Moreover, we will be securing more than 500 new hospital beds for those with moderate symptoms of COVID-19 patients. And also in the metropolitan area, at general hospitals, about 20 hospitals here in the metropolitan area, we will make sure that they secure about 5% and they designate about 5% of their hospital beds to treat COVID-19 patients. If we secure such hospital beds going forward, we believe that we are capable to respond to about 1,600 daily cases in the metropolitan area. This administrative order will be issued today, and all of the hospitals will also need to immediately secure more hospital beds so that they could treat these COVID-19 patients during the course of the next 2 weeks. We also have a joint sharing of hospital beds in these areas so that we could also allocate more hospital beds to the COVID-19 patients. And considering and reflecting such capacity of our medical response capacity, we have been listening to the feedback of the local authorities, and this decision has been made. And despite these difficulties and challenges, we also have many medical facilities which are dedicating their resources to treat COVID-19 hospitals. We thank you once again. We will make sure that you are provided with rewards and also benefits so that you do not have any disadvantages when treating COVID-19 patients. Moreover, my thanks also go to many medical workers who are also exerting exerting their full efforts to fight COVID-19 even at this moment as we speak. And we also discussed measures to intensify the quarantine measures at the religious services. And currently at level 4, we are limiting the attendance cap about 10% and about 20% for level areas with level 3. We have seen a continued decline in the cluster infection stemming from such religious centers. However, we have seen a rebound in the number of cases stemming from such places of worship. And we believe that there have been many more group meetings within churches, and we also see many more people attending these services. And in the metropolitan area and the city of Busan, we will be dispatching the on-site inspection, and we will also make sure during every weekend to carry out on-site inspection as well. And moreover, the culture ministry here in South Korea is cooperating with other ministries, and it will further look into the religious centers which are prone to these virus infections. And even at this moment today, we also have many people in the religious circles who are exerting their full efforts to contain the spread of the virus by complying with the stringent quarantine measures. And we ask you for your continued participation during this weekend as well. And the government will also continue to work with the people in these religious circles so that we can make a safer society. And yesterday, centering around the 50s, those in the 50s, we have about 166,000 people who received their first COVID-19 dose, a vaccine dose that is. And yesterday, we also have about 700,000 people receiving their second dose as well. And we have about 42.8% of the people receiving their first dose, while 17.4% of the population have been fully vaccinated. And also today, beginning from 8 p.m., we will be opening the vaccination bookings for those aged between 18 and 49 whose birth dates end with 3. We are currently having a smooth booking for the reservations, and however, we are also seeing the people who have already signed up amounting to only about 60% of all of the eligible recipients. So we ask continuously to ask the eligible recipients of the vaccines to continue to make your reservations going forward. Moreover, the seniors between the ages of 60 and 74, we are also opening the reservations for this group of people as well. And if you have not yet received your COVID-19 vaccine, please do so. And during this weekend, we have the Liberation Day holiday coming up. And we believe that many people are feeling prolonged fatigue due to the COVID-19. However, we are continuing to grapple with the spread of the Delta variant and the fourth wave. And we are also seeing a sizable size of the COVID-19 patients on a daily basis. So we need to highlight the fact that we need to minimize our movement. If we do not stop ourselves, the virus would not stop itself. So we ask you to also refrain from moving and also gathering during this weekend, celebrating the Liberation Day. And once again, we ask you to stay home as much as possible. The government will work with the public to contain the COVID-19 pandemic as soon as possible. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다.
That was the government briefing on the COVID-19 situation here in the country. 1,990 new cases were confirmed on Friday, slightly up on the previous day. All but 77 cases were locally transmitted, raising the total caseload to 220,000. We'll wrap up the coverage here. For more, we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.